Well, welcome back, everyone. Welcome back to Advocates for Nurses podcast. This is January 2025. It is even hard to believe it. And so today I have a treat for you. I have Citizen Nurse. If you don't know who she is, you really do need to follow her. And when I saw her on TikTok, I was so utterly impressed because I don't think that we understand civics. And she's going to go into that a little bit more as nurses. It's not talked about in school. I've been in healthcare for 24 years, and I know that it all ties back to that. So who better to have than someone who's going to break it down? And I love when she said, and I'm going to age myself here, Schoolhouse Rock. I was like, yes, ma'am. So without further ado, I thought January would be the great month for us to start talking about this. So please, without further ado, introduce yourself, tell us what Citizen Nurse means, and then just some of your history.
Sure. And Maggie, that was a very, very kind introduction, and I'm very honored to be here and excited because I know about the great work you're doing. So I'm very, very thankful that you asked me to join. But I am a nurse by background, and I think it's important to say because sometimes people do these social media accounts and they're not like really in the field. It's like a comedy or joke account or whatever. But I am a nurse by background. I been in oncology nursing for a better part of 20 years now. And, I worked in NICU, I've worked in med surg, so kind of the whole gamut. And my most recent journey has been in nursing leadership. So the reason I got into social media and, combining nursing is, kind of putting my two loves together. I love social media. I really love what I do. And in my leadership journey, I really have felt like there is not enough advocacy for nurses beyond the bedside. Beyond the hospital walls. And really, that's where the decisions about our profession is made is, a lot of times in these government agencies, the government itself, boards of nursing, things like that. So we really have to be in tune with what's happening out there because decisions are being made without us and will ultimately affect how nurses practice at the bedside. So that's how I got into this journey. But also fully aware that in order to reach the biggest audience, social media is a great tool for anyone that wants to reach a great audience. And using some of our my nursing skills on how we educate our patients, we know that in order to really make sure that the patient is leaving with the knowledge you want to impart to them, you're meeting them where they're at, right? So that's where the whole schoolhouse rock thing is. Like
Yes.
we went to school for nursing, not political science. So, how do I learn this? Because, we learned in fifth grade or high school or wherever we learned it. How do I relearn it again and then package it in a way that I want to make sure that, nurses out there in the digital world understand the message. So that's kind of like in a nutshell
Yeah.
what
And
my journey
why?
is and what I do.
And why? Because that is the other big
Yeah.
piece that I think that the nurses do miss as well. And I've been in this for 2 decades, like yourself, a long time. So we forget why that is important. So
Yes. Yeah.
because like you said, there are changes that are being made in about us and in our environments that are affecting us. So to your point,
Mhm.
when we don't understand or know about some basic civics, or that can affect our practice. I was spurred to advocate for nursing after I left
Mhm.
the board of nursing, and I was like, wait, what's happening here? So I did go to
Mhm.
my representatives, but I was clueless.
Yeah.
But then I
Yeah.
realized how powerful they really are. And so when I wanted some change made, I went to my representatives. And have you found in my own experience, nurses I think, have a misconception like it's going to cost me hours. I'm going to be doing all this work. And that's really, I have found yes and no. To give testimony, sure, may take a little bit longer. You reach out to your representative, you email your representative. This is a 7-minute situation.
Yeah. Well, in terms of the time it takes, I think it really aligns with what you're passionate about. Because I'm like, if you're passionate about something, you're gonna put as much time and effort that you want into it to get the result you hope to achieve. But nowadays, the way, I mean, and you know, these legislators, these congressmen, they're busy as well, right? Like they as much as we probably want to talk to them for 2-3 hours, like they have a busy schedule. So you know, if you are able to make a meeting with your lawmaker, I mean, meetings are like maybe 15-20 minutes tops, if that. I mean, you have to go in with an agenda, know what your message is, have an ask. And it's really akin to what we do as nurses when we're doing our rounds first thing in the morning on patients, right? You know, you can't be in that room for an hour doing a head to toe assessment. You got like, you know, 5-6 patients that you have. So it's like maybe what, I mean, you, in my prime, when I was in bedside nursing a long time ago, and when there were no ratios, I mean, I gave myself 5 minutes. I needed to build that rapport with the patient, you know, kind of establish a little bit of trust and, you know, and have a plan for both of us for the day and then move on to the next patient. So the same thing when you're meeting with your lawmakers, you have to be very strategic in how you speak. But now we can also leverage technology. I mean, if there's like bills that you want to support, if there's you know, anything happening, right? Like most of the time you can click on a
An
link on
alert.
your alert through your either your nursing association, through your congressman's website. There might be a link that you
The
can click.
state, the state
Yeah,
has a website as well, because this is what I do to
yeah,
your point. I set
yeah,
alerts, I follow bills,
yeah.
and use your junk email. It doesn't have to be the
Hmm.
one that you check every single day, but
Hmm.
to your point, yes. So
Yeah,
that's awesome, because nurses, I don't think realize how accessible they can be on all these social media platforms. The most responses I've ever gotten from my representatives have been on DMs, on Instagram, on
hmm,
TikTok, on that's where I've gotten the most response from. It surely wasn't my representative, but someone in their office, their chief of staff. So
yeah, yeah,
absolutely.
yeah.
Um, what have you found to work the best as it pertains to, say, you're following bill about staffing, you're
Hmm.
passionate about this, and so you want to let your representative know that, you know, you want them to vote for it. So like
Yeah,
walking us through, like, I don't even know who represents, like, how would I even, what does that even look like? Am I even registered to vote? So will you just,
sure.
you know, those
Absolutely.
things are very important.
There's well, I think at the basic, and this is what I do on Citizen Nurses, you know, I love to just talk about things at the basic level because I'm like, that's what we really need to know. We have like busy lives and you know, there's so many things to do. So what is it that I want to impart in that like minute and 30 seconds? If that, I mean, actually a minute and 30 seconds in social media is like an eternity. So the shorter the better, right? But two great sources are congress.gov. So if you go to congress.gov, you put in your, actually, let me see here. I want to make sure. Yeah, you put in your zip code, and then it will let you know who your representative is. And then there's links that will take you to their page. So that's one way to know who your federal representative is. Like, you know, you have your senator and you have your congressman, House of Representatives, right? The upper and the lower house. But it's also important to know your state representatives because we also have state senators and assembly members and all of that. So if you go to your state website, you'll be able to find links to that. If you go to vote.gov or vote.org, you'll be able to see your voting status. And if you are registered to vote, you'll find out. If you're not registered to vote, it makes it so easy to register on there. And if you know for sure you're not registered to vote, you know, please go there now. And there might not be an election for a while, but it will, there's local elections that happen all the time, and those elections are very important. But also too, if you happen to be renewing your driver's license or have any business down at the DMV, I think one of the questions that they always ask is, are you registered to vote? And then you can also register through their system as well. So, you know, that's a very good start is know who represents you, um, know what their views are in relation to what your views are. And, you know, like in my cases where I live in my district, my representatives, I feel like they align with my views and I feel like, you know, what they represent in at the federal level to reflect in my local community, like I'm good with that. I'm happy with my representatives. I voted for them. But you might be living in a place where you're like, oh, I don't know what they're doing really aligns with what I believe in, or I don't like what they're doing. And this is really important to know that you really have to flip the power dynamic here is while they are representing you, or while they're congressmen and that they're in Washington, D.C., they're representing you. So really, you're their boss, right? I mean, they're voted into office, they're there for a while, but like, when election season runs around, it's like the ultimate performance evaluation for them. So anybody that has had like a stint in nursing leadership or a supervisor, manager, whatever, right? You give your evaluations to your staff, and a no vote for someone that doesn't represent your views, that's a very strong evaluation, I think. But also, if it's someone that doesn't align with your beliefs, make that connection with them, build that relationship with them, make yourself known. And you're not gonna open any doors by just being very, how do I say it? Like kind of difficult, I guess. Like, if you go in there, like think of yourself as the patient in the bed. If your nurse came into the room and just like very brash and just, well, didn't even knock in the first place, just like went into the room, didn't introduce themselves and just started telling you, this is what you need to do for the day. Are you going to listen to that nurse the rest of the day? I mean, you might either just be like really angry or just scared, or, just like totally tune out and like I'm not going to follow anything that this person is saying. So you're representing not just yourself, but as a nursing profession when you talk to your legislators. So you're going to introduce yourself. You're going to build that, again, like I said, rapport. You're going to make sure that you're presenting yourself in a professional way. And the thing that really speaks to the legislators are stories. So going back to your staffing scenario, you can give them stats, you can give them research, but they don't really, they can get that for themselves. What they can't get are stories. Tell them about the time that you worked in, I don't know, in that med surge floor when you were 4 nurses down and you had all these really sick patients and you couldn't practice safely and provide the care you needed. And, as a result, like you ended up leaving the profession or somebody got written up because they were not practicing safely. Like those stories will really speak to your representatives. As you know, stories stay with you, and that gives them something to work with if they decide to advocate for your issue, and in government, if there's a bill or anything, they really utilize those
They remember
stories.
that
They
story,
do.
right?
They
And they're like,
do.
wait. I had a constituent, holy cow, who reached out to me
Yeah.
about this very thing. And
Yeah.
to your point, when I don't pick a side of the aisle when it comes to nursing stuff.
Mm-hmm.
I
Mm-hmm.
hit them all
Mm-hmm.
up. I don't care, red,
Yeah.
green, liberal,
Yeah.
zone.
Yeah. Yeah.
Yeah.
Yes.
People who have helped me the most weren't even what I would consider to
Yeah.
be side of the aisle.
Yeah.
So when it comes to nursing stuff versus kind of what you touched on as well, maybe what your personal beliefs are, those two I feel like can be a little bit different. And when you're advocating for, the nursing profession, you may want to, I always suggest that you go to both sides of the aisle. So that would
Oh,
be
sure.
your Republican, your Democrat, for the audience who may not. There are, people who hold different offices, and she talked a little bit about as well local. Like I couldn't even reiterate how important that is. We oftentimes forget about that, but that's real stuff from city
Yeah.
council all the way up. Um,
Yeah.
but getting involved, understanding who represents you, not picking a side of the aisle. And the other people that I more often not stand in front of personally is the public health committee, because they're
Yeah.
a lot of the stuff that I advocate for is like the board of nursing stuff. So
Mm-hmm.
they are the ones who like sunset. So picking as well who you stand in front of, I think matters as well. And then you have to hear things, I think they say 7 to 10 times before you actually retain it.
Yeah.
So even if you can't talk to your representative, which is totally acceptable, I have an email that I paste and I pick like, twice a month. And I'm like, hey, Bob, still me out here.
Yeah.
You know
Yeah.
what I mean? And so the squeaky wheel does get oil, because again, it may be their lead counsel, it may be their chief of staff who does read those emails, and it's not,
Mm-hmm.
the representative shaking hands and kisses babies, because that's what they're supposed to
Mm-hmm.
be doing. But, to your point,
Mm-hmm.
with local stuff. Have you seen? Um, I don't think people understand the power of local either, and
Oh yeah. So,
state.
yeah. It's very, very powerful. And I mean, you just said so many wonderful things right now, like absolutely, like in terms of building relationships. I spoke to my assembly member's legislative director, I think of this year. And that's the thing too, when you're meeting with your lawmakers, you may not actually meet them because they're, you know, voting or doing other things. And so you might meet with whoever heads that certain policy committee. So for all the things that I speak to them with, it has to do with health. So it's usually their health committee chair or their legislative director, and they're very smart. Like they totally
And they
know the
appreciate us. Can you
landscape.
just say this again? Because they
Yes.
may not even have nurses and they're like, wait, hold on. They're taking notes. We're like, say that again.
Yeah, yeah, they do.
They
They really
appreciate
appreciate.
us.
They do, they do. And I have this, like, if I can just throw this in there, there's
Good.
a nurse I know, her name is Martha. She's from down here in Southern California, and she always shares this great story where the 405 is one of our busiest freeways here in Southern California. And so she always tells a story that if you were sitting on this busy freeway and you look around you, there's probably, you know, car behind, car in front of you, and, you know, one to the left, one to the right. One of those is probably a nurse. Like that's how
Yeah.
many nurses are out there. So it just brings the point of there are so many nurses, but we're not seen and we're not heard. So why is that? We need to be more seen. We need to be more heard. Speaking of people that represent us in Congress or the legislature, there are
You need to be
doctors that
running for office. So that's my next question.
are
When are you running? I'm sorry,
oh
what
no,
are
no,
you
no.
running for? I'm sorry, I missed that. I missed that.
Well, you know, that's the thing. When I started this, people thought, oh, I must be running for something. And I'm like, no, 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 I'm not. Believe me, I'm not running for anything. I'm here for the education. And the nonpartisanship part is very, very important to me because I want as many people to hear the message and use these tools for what they need to do. You know, you don't want to like turn off half of your audience out there, right? Same thing. I always go back to nursing is how can you teach something? How can you share something that your patient and their family members are going to be open to it? And yeah, so just going back to, you know, these senators, assembly members, and so forth. I mean, they are not born an assembly member, you know, like most of them are like businessmen prior. Some are
Yes,
doctors, lawyers, dentists. There are very, very few nurses
correct.
representing us at the highest level. I think on the federal level, two or three, maybe at the maybe four. I know I have to look again, but there are not many.
Right.
And you know, there are more on the state level. But as you said, like the stuff that happens locally impacts you the quickest. You know, things that roll down from the federal government, it takes time, right? They may make a decision about something, but you know, it usually takes time for it to roll down to where you are living in your community. But you think about your school board elections, your public health department elections. Um, those people that are elected are going to have like an impact on, you know, school meals for your children or what
Our
happens
school
with
nurses, or who's going
school
to get, because
nurses.
for us, that
Yeah,
involves, right, the school nurses. So
yeah,
now that
yeah,
affects your pay. Now, whether you were an LPN, you're an
yeah,
RN, whether you have,
yeah,
you're an RN and you have 20 LPNs. So yeah, that
yeah.
matters.
It matters, or the state level too, like for the nurse practitioners, right? That differs in different states. So
Yes.
you want to advocate for how nurse practitioners practice in your state. You have to speak to your state lawmakers, and so you have to know your audience. Again, too, and I like to do the parallels and bring it back home for nurses. But you know, if you have a complaint about your patient's what's on their lunch tray, you're not going to be calling the physical therapist, right? You're going to be calling the dietary staff or maybe I'm the dietitian or something like that, right? So know your audience, know the rules, because believe me, they know all the rules. So it really behooves us to know what the rules are. And in a way, it can be tricky because you know they may not know, they may not want to share exactly all the rules with us, right? So we have to know that and that's what I'm here to do is, you know, to partner with you and to navigate through all this together. And I'm learning as well. I really am learning. I mean,
Ditto,
when I started
ditto.
this journey, I broke out like a fifth grade civics book. I'm like, let me get back, let me get back to basics. And then just meeting nurses like you, those who are actually involved in you know, their states or their counties and things like that, and knowing the ins and outs and how to build these relationships. That's really helped me a lot as well. And there's so much information out there. Again, we didn't go to nursing school to learn about this stuff, right? So how can we integrate that into our practice, or where are the resources? And I have some friends who are nursing professors, and I always like bug them. I'm like, you guys need like a health policy course, or you need
Yep,
something like
yep.
in your
Hold on, that's one of my
curriculum.
questions here, because that is really one of my questions, because I
Yeah.
am truly a believer, to your point, around some of the civics. Mine, I am a true believer that the rules and regulations that dictate our professional license does
Yeah.
need to be dumbed down. Most rules and regulations in most states are written at the graduate level. The NCLEX is in the 10th grade level. Let me say that again. The rules and regulations that are dictating our practice are in graduate level,
Mhm.
but yet the rules and regulations are in 10th grade level. There's a huge discrepancy there. So I think that Texas and New Mexico, I think there's a handful, Arizona teach some jurisprudence for all providers, but it's not required in all states. And I
It's not required.
think
Yeah. Yeah.
that nurses don't understand the intersection of their license, the law, civics, what that
Yeah.
means, or even
Yeah.
what some of their recourse,
Mhm.
what some of their recourse is. So running
Yeah.
for office, I think, is horribly important. Now, I'm not running, but I will support anyone who is running. But I do think Lolly Lockhart's one of my mentors. She's a PhD retired nurse, and she wrote the book like Nurses in Office. I mean, if we
Mhm.
voice, we have to be at the table, but
Yeah.
not enough of us are, to your
Yeah.
point. But there are not a
Yeah.
lot. There are way more men who are in political office than there are women as a rule. And then what's the majority of our population as nurses?
Yeah.
And
Yeah.
there it is.
Well, and there it
Um,
is. Yeah. Yeah. And I mean, there are millions, 4.5 million nurses in the United States. And
we are more than
um,
capable. We are
we are
more
more
than
than capable. I
capable.
mean, how many masters and DMP prepared nurses are out there?
More today than ever
Yeah.
before.
Yeah. And then these CNOs, or, you know, directors and all that. I mean, they're running businesses, so
Yes.
they can definitely function beyond that. So a really important point that I myself often forget about is when I started my journey, I was a nursing supervisor, and during COVID. So I was really like stuck in the middle, and, you know, telling my staff these new policies. Our policies almost changed like almost every day, I felt like, or whatever the CDC you know, had one day like changed like in a couple days. So I really felt like the middle person, and like quite honestly, like I would be telling my staff things and I'm like, oh my gosh, like I just I'm fibbing at this point because I really don't know what tomorrow's gonna look like. But you know, and I didn't like that feeling. So um that's why I started doing more research, like who's writing these policies, like who is behind these decisions. And I think for nurses in the hospital, if you're complaining about your boss, you know, look beyond that, because, you know, they're probably held to rules and regulations that like, you know, have to tie their hands as well. So there's power in looking beyond your boss and the C-suite and all that, because that's where all these directives and regulations come from. And going back to health policy, yes, nurses are great at, will be great at writing more health policies out there, but you know, there's not many out there. Like they need to get out
Right.
there.
Yes. I haven't crossed that many
Yeah.
that are in the health policy space, but and or in when I see, leaders and they're not nurses and they're like putting out rules and our policies, I'm like, no, how is this
Yeah.
happening?
Yeah.
We
Yeah.
need to be
Yeah.
demanding to be at the table where these
Yeah.
policies are written, because I have seen policies that don't mirror scope of practice, align with scope of
Hmm.
practice. And
Hmm.
when the nurse shows up and they do the job, the board of nursing doesn't care what your job description says. They will ask you, did you or did you not deviate from the standard care, irregardless of what your
Yeah.
organization says. So yes,
Yeah.
to your point, and I tell nurses this all the time. I was
Hmm.
to come speak to CNO reached out to me because the nurses were like copying, deleting, and then TikToking out. And yeah, big problems
Oh.
with nursing leadership. And so we just did some re-education, not throwing anyone on the bus, right? We just,
Yeah. Yeah.
re-educate people. We give them, some of the tools that, they need. But to your point, then people don't realize, and I was just saying, just like in a factual manner that the
Mhm.
CNO has a different responsibility than you as the bedside nurse. I'm responsible for the patients, but if I
Yeah.
clock in as a CNO, I'm responsible for the whole gig. You know what I mean?
Yeah.
And
Yeah.
people I don't think fully realize that at the end of the day, like 217.12.2 in my state says specifically chief nursing officer, right? And that's
Yeah.
under unprofessional conduct. They
Mhm.
have their
Mhm.
own rules and regulations. So being able to put
Mhm.
yourself into someone else's position and just to say for a minute, now I'm not here to say that they're never abusive, nurse
Mhm.
leaders or even people you
Mhm.
stand next to. They don't even have to be a leader.
Mhm.
And should you
Mhm.
tolerate that? No, you should not. But more often than not, it's a lack of our experience and our foresight to see that they're held to, oh, wait, holy cow, rules and regulations I didn't even know about. Right. And
Yeah.
then we don't take that into consideration. So, yes, I
Yeah.
agree. And then
Yeah.
to your point, and coming back to, what you and I are both trying to do is
Mhm.
advocacy, right?
Yeah.
We're here trying to do nursing advocacy. And so when people reach out to me like, I want to be an advocate, I'm like, oh, it's not unique to me, folks. It's just like,
Yeah.
how
Yeah.
do I do it? And so to your point, understanding some basic civics and why when I stumbled upon you, I was like, yes.
Yeah. Yeah. Well, same, same. I mean, when we connected, I was like, "Oh, this is amazing. I'm glad." And I think this is probably one of my favorite things about this journey is I started like just meeting people like you. Like there is a community of really passionate nurses that know that this is important.
Yeah.
And there's not enough of us. I mean, it's a very small community. I mean, between you and me, we could probably like name a lot of people, right, that are doing it, but then that's really like, it.
Yes. I mean,
But yeah, so I think more nurses need to be proactive that way. I mean, blaming your boss, blaming your organization is not going to get you far. Like look beyond that, see what's really happening. One big thing out there that's brewing right now that I think all nurses that work with this in their space is telehealth, right? That really helped us a lot during the pandemic, but they might roll that back. So what is that going to mean for people that live in rural communities? I mean, Texas, California, they're huge states, right? So it's taking away care from people that don't have reliable transportation or, can't like have to drive 2 hours just to see
I
their
didn't know
family
they were
doctor.
trying to yank this. I didn't know.
Yeah, there's a lot of, back and forth on it now, and I've been following it, but
At the
that was like in
federal
the
level, at the
at the
state level.
federal for now. I mean, I haven't looked at the individual the other
Yeah.
states, but I mean, there might be different. So that's another thing too. What happens at the federal level um may not have the same impact on the state level. So, understanding the
Yeah.
dynamic of those two levels of government is important as well. And, by the time
And then to
that
your
this
point,
airs, like, yeah.
right. Right. To your point, when if this does affect you and say you are in the telehealth space, whatever it is you're doing, this is the time that we just talked about where you're going to hold on because and it'll be in the show notes, folks. You're going to go to vote.org or vote.com. I apologize. I got it written down here.
Oh, vote.gov.
Vote.gov. You're going to make sure you're registered to vote. And then
Yeah.
you're going to who represents me. And then you're going to start calling or TikToking or send a
Yeah.
quick little message. You can use chat. You can use any AI. This could be 4 sentences. And you just say, hey, Representative Bob, I am in the telehealth space and I have concerns about this, whatever it is. You can copy
Yeah.
and paste that and send that. But I didn't realize that. And to your point, um, another one just going to swing back to if you are in this space, there are websites that we've talked about that are for like federal bills and then state bills. Like I go and I look to see, I just type in like nurse and it can be a little bit overwhelming. Some of these, the way that it's set up, but if you type in like nurse, or if you follow one of us or other people who are talking about different bills, because the onus doesn't necessarily always have to be on you, right? And then you set your reminder. That's what I do. I set a reminder. This is when the bill's coming up. And then I start blowing up my representative in an email form, right? I'm not calling him just because, again, I don't have time. This is a 5-minute situation at best. I'm copy and paste and say, I'm out here, bill 5472, whatever it is out
Yeah.
there. And I say no. So, and
Yeah.
I take that a step further because I do go to the Capitol. I do walk into their office. I'm like, hey, I might sit and have to wait because I don't have a meeting, but I'm going to talk.
Yes.
Um, and then
Yeah.
I say, I have a list of nurses. So if they can't show up, I have their names on a list
Yeah.
and I'm like, hey, I have, looks like 400,000 nurses in this state. I mean, I don't want to bore you with those details there, sir, ma'am,
Yeah.
but that's your next job election. But I mean, I
Yeah.
digress. But to
Yeah.
your point, that stuff is very powerful. And I
Yeah.
let them know I'm a nurse in the state. I have a business in the state. I represent nurses,
Mhm.
not legally, but as in, nursing advocacy
Yeah.
and getting stuff changed. So I
Yeah.
think it is grossly important for us to get involved. And it doesn't have to be, we're raising kids, we have 5 jobs, we have a
Yeah.
life. It doesn't have to be anything that has to be
Yeah.
exhaustive.
Yeah.
Have you just, we're gonna, finish this up. I know this is, going a little over. Have you thought about law school, sister? Are you?
Actually, I have most recently, and I actually have a good friend. She was a lawyer first, and then went into nursing. And then I also know
What?
someone who's
What just
yeah, she was a
happened?
lawyer first, and she's happy as a nurse. Like she like law. I don't know if she's out there. She's gonna watch this. I'm gonna tell her to watch it. But I'm talking about you, Wendy.
I love it.
But I mean, she's a wonderful nurse. Well, wonderful
Yes.
nurse. But I mean, her knowledge though, like is just wonderful because she has like the best of both worlds. I thought about it because then you get like more of a formal education on what is happening out there and how you can advocate and maneuver through or navigate through the system. But I always think, well, that's years and years of school versus I can just do something now and
Yeah.
leverage the connections I have of friends who are lawyers or nurse JDs or something, right? And build that community so you have your go-to people. But like again, too, like knowing what those laws and regulations are and the differences between states or even counties sometimes is so important. So I'm from California and I remember the days of not having nursing ratios, and that's when I was like a baby nurse. And I mean like 14 patients on a night shift and with one LVN, LPN, like that was the day where I left the bedside because I was like, I'm not safe, my patients are not safe. And I felt like my organization at the time, they really didn't care. But at the same time, the charge nurse was like, well, I don't know what else to do. And then years went by and we had the staffing ratio. And so in my mind, I was like, oh, great, nursing is wonderful now across the country. And then I started meeting travelers and they're like, no, we're coming to California because we have no ratios in our state. And I was like, what? You don't have ratios in your state? So, being aware of how nurses practice differs, right, in other states is also important because I mean, yay, great, everything is good where you happen to be and you don't think you need to do anything to make things better. But let's reach out there and advocate for the profession and in that state where nursing needs more help or needs more of a voice. I mean, it's a community, we're all in it
Thank you for
together.
that.
When there's a win for one of us, it's really a win for all of us. Because this is another thing I really learned at the beginning of the pandemic is like we are accountable for our profession. No one's out there to help us. No one's out there to I really felt like no one had our back, so we have to
I
have it
did.
for
I
us.
felt the same way. Yeah.
Yeah, like it's all us. So we have to be accountable. We can complain and make all the noise we want, but let's do something about it. We are very powerful. And if I could share a secret with you, make sure
Yes.
nobody else knows this. Make sure no one watching this tells it to anyone.
Shh.
But nurses are so powerful. We are more powerful than we even realize. And the group that realizes how powerful nursing is and taps into that is gonna really just win whatever they're trying to do. So let's make it be a nurse that
Yeah.
taps into that power and leads us. And
In
I really
office
think
as a president
is
in our lifetime. Who knows?
who
That's what
knows?
that's what changed this world.
Yeah,
We get a a,
yeah,
a, a
yeah.
nurse in office, everything will
Yeah,
get better.
yeah. And that's kind of like my wish list or my magic wand thinking is if you had a nurse in a really high office based on our ethics, and people go into nursing because they're compassionate individuals. They want to help, they want to do something. So think of that person at a high level of office in charge of policies. I mean, you are looking at it through a compassionate lens. You're looking at it from an ethical lens. I mean, that's kind of our training. And I'm hoping, right, as a nurse, and you have all these stories and experiences of your patients, that you wouldn't betray the trust of like years of patient stories and family just building relationship with you and doing something that's contrary that will like basically destroy healthcare, right? Like we want things better, not just for current patients, but future patients. And now that I'm moving, closer and closer to the mid-century mark and we'll be past it soon, I'm going to be in there in the bed too. And I want people taking care of me that are passionate about nursing and want the best for their patient. And my CNO, she said this, and it's so true. People go to clinics to see their doctors, but people go to hospitals and they see nurses there, right? Nurses are pretty much in charge of their care. So nurses are so powerful. And when we start believing in our collective power and what we can do, I really think that the face of healthcare in this country is really going to change for the better, like in a very huge way. So we just got to get a bigger community of nurses going.
Yep. And then we have to extend our hand to one another. The day and age that
Yeah,
we eat our own, like I'm tired of that. I
yeah,
hear that almost daily, and that
yeah,
just has to end. It doesn't matter
yeah.
what unit you're on, it doesn't matter where you're at. We
Mhm.
support one another. We don't throw each other under the bus. That's just, we are very powerful. We are
Mhm.
almost 5 million strong. And to your point, once we start owning this, they need to be really scared. And why
Yeah,
we haven't been able to tap into this is because some of it is it's just so fractured and how we are. But I think, to your point with social media, with us, having platforms and speaking up, I think that us all coming together to advocate for our profession, upholding the integrity of our profession, to your point, because that is what I'm about. I'm all about standing next to the bedside nurse, but I'm also like, if you did something, you got to own it, because we have to
yeah,
hold the integrity of our
we
professions.
do. Yeah, we have our code of ethics. It's like,
Mm.
not like a retail job. There's no code of ethics in a real retail job other than your own. But like if you're in the hospital, you have your job description and you have your code of ethics to abide by, right? So you have a higher responsibility because you're serving the public.
Yeah. And it's really, it comes down to, the duty that we all have. 1514 in my own state. I know that I love some policy says that I have a duty to the patient that supersedes a hospital policy or physician order. And that was passed in 1983. And most nurses really don't have any idea. And some of the stuff that you talked about. So now you're a compact nurse. You weren't trained in Texas. You're
Yeah,
coming to Texas. Do you know about 1514? But you see what I mean? To your
yeah,
point, is that education does have to be across the United States. It has to be in
yes,
schools. I think even to the point where the National Council of State Boards of Nursing comes in and it's all boards of nursing. It's not, in your state, you're under the ALJ. I in Texas have a traditional board of nursing. Michigan's under DHS. Like,
yeah,
stop. That
yeah. It's
has to
different.
end.
Yeah.
It's confusing to a nurse, and that's not
Hmm.
fair.
Hmm.
So I think having general structures, that the rules and regulations are written in 10th grade level. And then I do love, and I oftentimes tell a nurse to go to the frequently asked questions on the board of nursing website, because front
Hmm.
facing, especially Texas, it does have the ability to dumb it down. For example, can an LPN triage? It says specifically in the frequently asked questions, not necessarily in the rules, but dumbs it down, saying no, it's not
Yeah,
with scope, but explains why. The person calling you doesn't have enough information, the person taking the
yeah,
call, because of their education, training, and knowledge. So I do think that through some advocacy, through some education, more nurses getting into not only just JD, which is a lawyer, but there's like health policy
yeah.
degrees. There's
Hmm.
different stuff, to both of our points, where nurses could, align them in this space, sit at tables, run for office, be chief of staff or back of the office. Who cares? As long as you're
Yeah,
somewhere where you're, like Rebecca Love says, like we're done. We're bringing the tables and the chairs, folks. We're done
we
with,
are.
we're bringing
Yes,
those like we do,
absolutely.
and the
Yeah,
whole, like
yeah,
we always do. So we're bringing those.
yeah, yeah,
But just as we wrap it up, will you tell my audience, I follow Citizen Nurse on TikTok, but that could possibly going away January 19th. This will be airing in January, so
yeah.
I'm sure. So tell us, I know you're on Instagram, but where can people find you if they want to speak to you? I know I saw you on, you met with other nurses, and you just did like, um, I just saw this yesterday. What was it?
Oh, it was a podcast.
Yes, Harper, I just saw that.
Through oh my gosh, I'm trying to think now. Well, so I'm on LinkedIn. You can find me, Gilanie De Castro. I'm Instagram, TikTok, my YouTube, I have to get better at, but I'm trying to get longer content on there. Um, And again, to a lot of nurses, if not many nurses that are doing this, right? Like it's our passion. So we're doing it outside of our working hours and,
Yeah.
and all that. So trying to
Yeah.
find like where we can do this. But, I do, I do like to have different sorts of content. So, please follow me through there. But, I also like to, spread my message on podcasts and things like this, like with Maggie. There was another podcast I spoke
I
on,
got it. It's healthcare
just
rule
recently.
breakers. Healthcare.
Healthcare rule
Yes.
breakers,
Yes.
yes.
That
So
was
there
good.
are two wonderful friends of mine that are nursing leaders. So I met them through the AONL, which is the American Organization of Nursing Leaders. But we need to get more nursing voices out there. We may feel like, oh, there's lots of nurses on social media because we follow them, but really we are just like a tiny dot. And about that metaphor about the tables and the chairs, I'm like, it's a great that you bring the chair to the nursing table, but we have to get out there and also tell people that don't know anything about nurses about how important we are,
True
how
story.
wonderful, yeah, how wonderful we treat our patients. And it's counterintuitive because I know nursing is a very humble profession, but I mean, how if you ask someone out there what a nurse does, I mean, it's going to be hit or miss.
That's a
And
true
there's
story.
different levels of nursing, right? They don't know what an NP is versus a
A lot of times don't even know a
RN.
midwife is a nurse.
Yeah.
Most
Yeah.
times people don't know or nor realize that in this country that I don't believe it to be anything else but a nurse. Now that may be different in different states. That's not my
Yeah.
modality, but I
Yeah.
do believe that that's always a nurse in every state.
Yes. That's right. Or, and I don't want to focus too much on the negative, but sometimes, the general public, they have encounters with like certified nursing assistants or MAs, and then
Yes.
they blame nursing like, oh, the nurse didn't do this or do that, not knowing it's
Anyone
not
in
in their scope.
scrubs, they see
Yeah.
someone in scrubs and they're like, oh, that's a nurse. And
Yeah.
depending on where you're at, oftentimes they'll designate what the RN has to wear. But to your point, they're like, they
Yeah.
make these associations about us.
Yeah, and it can be a little, like I said, counterintuitive, but don't be afraid to get in there and say, "Hey, I'm a nurse and I save people's lives," and that's going to start a conversation about what you do. Um, so
Yes.
we're our best ambassadors, we're our best advocates, and we're the only ones that are going to make the change for us. So, like you said, link arms, and we're all in this together.
Yep. And make sure you follow a citizen nurse out there. She's doing some amazing stuff. She dumbs it down. She's talking about the Constitution. She does some really interesting stuff. When we're hearing about like terms like lame duck president, she talks about that stuff. We hear this stuff on the news. You're like, I have no idea. Or you did in fifth grade, but you can't
Yeah,
tap into that. You're like, I know this
yeah.
word. Or I feel so she even talks about some of that. So thank you for going on because I forget half of this stuff. I don't know a mere fraction of it. So I think that's why I was just like, I listen to all your stuff. I'm like, I love it. So
Oh,
thank you
thank you. Yeah, thank
for
you.
all that you do and for joining us in January 2025. Hard to believe and love all the stuff that you do. Are you doing anything just to wrap it up 25 that we should be looking out for? Are you speaking anywhere?
I do have so in California we have a California Oncology Nursing Society Advocacy Summit. It's in our third year. So that's something I'm very proud of. I was one of the founding members of that along with some of my wonderful nurse oncology colleagues. So what we
Oh,
do is we advocate for oncology nurses on the state level. So that's happening in April, May this year. But I love to share a lot of content about that. So
yeah. How can we
yeah,
support
please
you in
follow me.
that endeavor? How can we
Um,
follow
sure.
you, donations, or just tell us a little bit more? How can my audience support you if they want?
Sure. Well, there is a Instagram for that. It's California Advocacy Summit. So ONS California Advocacy Summit. And if you follow that, I mean, there's going to be information on how you can sign up or just spread the word. And if anything, I mean, if it inspires you to do something in your own state, with your own passion, I mean, I'd be more than happy to talk with you to let you know how to set something up like that. Um,
I
so
love
yeah,
it.
yeah.
I
So
love
I
it. I love it.
appreciate you letting me shout that out. And Maggie, just thank you so much for what you do and for really elevating the profession. So really appreciate it.
Ditto, ditto, ditto. It's gonna take all of us, sisters. Gonna take all
Yeah.
of us. So
Yes.
again, she did mention that she's on her day off and donating time to us. So this is right before the Christmas holiday. So I really do appreciate you taking the time. It does really mean a lot to me. So
Oh yeah.
thank you,
Yeah,
thank
I
you.
wouldn't miss this. Thank you so much, Maggie.
All right, sister. All right, folks, thank you so much. And make sure that you check out the case review. I did not do a traditional case review, I did one about how you can get involved, nursing advocacy, and the stuff that we talked about. So hopefully you enjoy that, and thank you so much.